Karla McAuliffe, it's a pleasure to talk with you today. Thank you for your time. You're a speech therapist, and that's very exciting to us because one thing we want to talk about at this point is VPD or hypernasality. Tell me what caregivers need to know about VPD or hypernasality.
You're saying VPD, that stands for velopharyngeal dysfunction. And hypernasality is as it sounds, hyper meaning excessive, and nasality, that the nasal emission through the nose, that quality of resonance that's just too much nasality in their speech. Velopharyngeal dysfunction is the technical term that's kind of differentiating the muscles involved. The velum, otherwise known as your soft palate, when we're speaking, it raises and forms contact with the pharynx, in layman's term, the back of your throat, and that contact seals off the nasal cavity from the oral cavity. And there are some sounds that we do not have that airflow through the nose, and there are some sounds that we do, like an or an that's a nasal sound. But when that bridge between the nasal cavity and the oral cavity, if that's impacted, if we don't have that proper seals, then that excessive airflow comes through the nose, and that's called hypernasality. And it affects not only the resonant quality of someone's speech, but it can impact a person's overall intensity, their loudness, because they're losing their air both through the mouth and their nose. It causes stress on the respiratory system because now they're going to have to work harder since they're losing so much air in their speech. It impacts articulation because they won't be able to form their sounds properly. Think of how when we make a p or a b, we need to build up that pressure in our mouth. And if we have air escaping through our nose, we don't have that ability to build up that pressure.
Especially now when everyone's wearing masks, it's so hard to communicate to begin with, but now you add hypernasality to it, and people having this situation may retreat and not feel like communicating.
Correct. We lose a lot of that visual signal in this age of speaking with masks on. And if someone is a little bit hard to understand, if their speech is negatively impacted, we as listeners don't even realize how much we'll be looking at their face to kind of figure out what it is that they're saying. And now we take away these visual cues and we're really lost.
The statistics tell the story. There are 6.5 million people living with strokes in the United States. A third of them have speech impediment. We know not all of the speech impediments are VPD or hypernasality, but there's a good percentage that will have that.
It's not the most common symptom we'll see. However, when we do see it, it can be very impactful. And so we would try a two-pronged approach in treating them. Both, what can we do to improve the function of the speech? Perhaps, is there anything we can do to improve the tone and the physiology of the musculature? And how do we compensate? Because you need, hopefully, to leave that session being able to speak a little bit more intelligibly because you want to interact with your family and friends and make your needs and wants and ideas known. So we try and focus on compensatory strategies to help get them out there and communicating as quickly as possible.
So how do you treat generally hypernasality?
We do try, like we mentioned, the compensatory strategies. Now, thinking again of how much they're losing the air supply through the nose and through the mouth, we might need to teach someone not to speak beyond their breath stream. So they may need to group their words, a couple words at a time, replenish their air supply, and then continue. Someone who has more severe hypernasality, we may even try, do you sound better if you close your nose? If you pinch the nostrils, do you notice an improved intelligibility? This isn't very functional going down the street with your nose closed to speak with someone, but say you have an important phone call to make, that might be a strategy just so that you can get out that important information.
Do you have experience with nasal obturators?
Haven't had folks who have used that, anything special, like anything clinically made for that, but I've had some folks like maybe a little bit of cotton or a little bit of tissue, and so a homemade nasal obturator, so to speak. So they've kind of made their own functional nasal obturators, but I haven't seen anything manufactured.
We learned of a group in London called Claritalk that has the little cups, 2 little cups, just lips into your bottom of your nose and seems to deflect the air from going where it shouldn't go, you know, creates a speech or
Restore some balance. Exactly. That sounds wonderful. I think it's fantastic. I wish I could come up with these ideas, like, so that I could market it and be successful with something like that. I think that's fantastic. That, yeah, we got to try and normalize that airflow in some way. So I think that's neat.
It also is striking that until these folks I met from London, there doesn't seem like there's been a professional obturator made. Everyone's just doing it kind of homemade. Hold your nose, use cotton. So
yes, I think it's fascinating. I'd like to look up that group in London. I'd like to learn more about that. So while it's not something we see frequently, it's nice when you do see someone. Let's provide some resources and some information where to go and where to look for help. To be able to offer someone the education and the resources of look this up, then that's useful.